Good afternoon.
Good afternoon.
I am Vincent Talaktak from 9
Hello. Nice to meet you.
We will just like you to answer some questions concerning about your professions.
Okay.
Do you mind introducing yourself first?
I'm Dr. Sidney Bravo. I'm an obstetrician gynecologist. My hospitals are Philippine General Hospital, Manila Doctors Hospital, and Medical Center Manila.
So let's begin with the first question. This set of questions are about the respiratory systems.
Okay.
First question. According to the Global Youth Tobacco Survey, more than 1 in 4 Filipinos children aged 13 to 15 are smokers. In addition, 23% of the Filipino adults are daily tobacco smokers. 38.2% of the male who on the average smoke 11 cigarettes a day, and 6.9% for females who on average smoke 7 cigarettes per day. How do you react on that?
Well, from the statistics that you have shown, ask the help of course, our Department of Health and other non-governmental organizations to make programs or to boost the existing anti-smoking programs, of course, to promote health and discourage our people, especially the youth, to go on with smoking.
I totally agree with that. Proceeding to number 2. What do you think is the difference between treatment and cure?
Treatment is a general term for offering management to your patients. So it could afford relief of your symptoms and of course cure. But if you say cure, the term cure means the patient will be totally free of disease after offering this form of management. So the main difference is that treatment can only relieve the symptoms, but it could also afford permanent relief of your symptoms or what you're feeling right now, no? But if you say cure, there is permanent absence of your disease, no, after undergoing this form of management or therapy.
Going to number 3, what does smoking do to our body, especially the lungs?
Okay, smoking does a lot of bad effects, no, on our body. First, it could cause, of course, cancers. Number 2, diseases or respiratory diseases. It could also cause problems with fertility, such as among males, it could cause infertility, and among females also. So in particular with the respiratory system, of course, primarily it could cause your chronic obstructive pulmonary diseases, such as bronchitis, asthmatic conditions, and of course, emphysema. So in essence, smoking, so there's nicotine and a lot of hydrocarbons and the toxic chemicals could destroy the cells in our lungs. Some of it would transform into cancerous cells, while the others, it could destroy the elasticity of our lungs, thereby producing emphysema, and so the patient will find it harder and harder to breathe as she or he ages.
On that explanation, how can you encourage or help others to stop smoking?
I think as a medical professional or healthcare provider, again, as I mentioned early on, I could, of course, influence the government to continue with their anti-smoking campaign. And of course, as a parent, again, I would actively advise my children not to have that habit of smoking. And of course, we should be active in the media, with regard to showing the ill effects or the bad effects of smoking. So we are all familiar with these posters that would show a cancerous lung, that lung system, the respiratory system that they're showing, it's all black with cancerous cells and other diseases are depicted as well. So I think that would scare most of us, no, looking at the picture. And together with it, we will enumerate the bad effects of smoking, such as having cancer, difficulty of breathing, so that's your producing your obstructive pulmonary diseases such as bronchitis, emphysema, asthma. And of course, we also have to list other ill effects such as effects on other people, because even if you're not smoking, the mere fact that you could inhale smoke from other people, that means you're having secondhand smoke, could also have bad effects on you. So like the patient or the smoker herself or himself, you could also get secondhand diseases like, of course, lung cancer and other respiratory diseases as well. So we should all be active, no, in continuing the government's effort in promoting or banning, no, smoking. Yeah, actually, we have some areas in our country started to ban smoke. So we all know smoking is totally banned in Davao and other regions as well. So hopefully in the near future here in Metro Manila, we're in together with pollution from vehicles and other factories, we should all contribute in helping to ban smoking in our place.
As we all know, the respiratory system has four phases: breathing, external respiration, internal respiration, and cellular respiration. Can you do a quick summary about that four phases?
Breathing is the physical act of taking in air, so it's mostly composed of nitrogen, right? And 25% of your oxygen, which is much needed. So it's the physical inhalation and expiration. So internal, what's that? Respiration. It's the process that takes place with external first. We go with external. Respiration takes place between the environment and the bronchial cells. Whereas internal respiration is the one taking place between the bronchi and your tissues. Okay. Whereas, what's the last?
The
Cellular. Well, at the cellular level, there's exchange of gases, no, between, of course, your blood and the cellular components of the body, such as your other tissues, no, your heart, your liver, spleen, and other internal organs. So that's at the cellular level where biochemical processes take in to bring oxygen and other much needed chemicals and gases to your system. And of course, that also includes your cardiovascular system.
Do you think lung transplant can be done? How or why not?
Yes, lung transplant has already been done in other countries, such as, of course, the United States and other developed countries. So in our country, it hasn't been done yet. But hopefully in the near future, as we get to be, well, a bit richer, we could afford the facilities, and with training of our local doctors, we could bring in the technology. So essentially, you have the recipient and the donor. The recipient is actually the patient, of course, who needs the lung, no? The donor would be, of course, a living individual. After matching, if they are matched, then the lung could be harvested from the donor and immediately transferred to the recipient or the patient. The procedure could take as long as 12 to 24 hours, so it could take whole day of operation. Yes, so with proper training, it is possible in our country, but in developed countries such as US, Canada, it has been done successfully, lung transplant.
Kill ourselves by choking or holding our breaths. Why or why not?
Okay, we cannot kill ourselves by or perform suicide by holding our breath, because if you hold our breath, we'll come to that point where we will lose consciousness. And when we lose consciousness, automatically that would send signals to our chemoreceptors to breathe again. So while being unconscious from that event, your body will naturally command your respiratory system to perform breathing. Unless, of course, you have told your colleague or your friend to cover your nose and your mouth. So essentially that's suffocation. So that's murder. But we cannot die from breath holding.
Go.
Now let's go on with the circulatory systems. Number one, what is the significant contribution of the circulatory system to the body, to our human body?
Circulatory system, of course, contains blood and other blood elements and water. So essentially, it circulates, bringing in nutrients and gases to all of our tissues, such as other organs, the skin, respiratory system, the liver, the GI tract. So with your circulatory system, you're able to get these nutrients. And of course, each organ or tissue would be able to perform its function when they get the gases and other chemicals that are brought in by the circulatory system.
Secondly, what is the main job of the red blood cells?
The red blood cells contain your hemoglobin, which acts as the vehicle to bind and transport oxygen. So oxygen is much needed in various biochemical processes in our body, of course, such as the heart, again your brain, again your liver, the GI tract, which is, of course, these organs are highly dependent on oxygen to bring about their process and fulfill their individual role to their capacity.
On that, what do you think, or the fact, what is the average number of blood cells that is produced?
Well, when you're talking of red blood cells, we're talking of billions. No? So daily, our body manufactures around 200 billion red blood cells daily. We also manufacture around 10 billion white blood cells daily, and around 400 billion platelets. So we're talking of billions, but these are actually replacement on the ongoing destruction of the existing red blood cells, such that there is enough homeostasis or balance. So that's it. We're manufacturing around 200 billion red blood cells on a daily basis.
Number four, how is oxygen important to red blood cells?
Okay. Oxygen is being carried by the hemoglobin content of the red blood cells. So essentially, oxygen, as we have mentioned earlier, through the transport molecule that's your hemoglobin, is being circulated throughout the body. From the heart, okay, so it goes down and up, including the brain, to provide oxygen, which catalyzes most of the biochemical reactions in our body. So essentially, with the carrier molecule, the hemoglobin, it brings about oxygen to other parts of the body, thereby other biochemical processes are performed at the cellular level, and each organ again will be able to do its function.
What are the diseases that are common to the circulatory system? What are the treatment or cure, and how can we prevent them?
Number one most common disease of our circulatory system is anemia, of course. So when we do not get enough source of iron from food or vitamins, we could get anemia, or we lack sleep or stress could also give us anemia. And certain hereditary diseases, these are genetic diseases that we could get from our parents, we could also get anemia. Most common cause of anemia among women is, of course, menstruation, so that's menstrual blood loss, and pregnancy. So to prevent these diseases, another disease is, of course, leukemia, although this is quite rare. This is cancer of the blood, wherein you have increase in your white blood cell production compared with your red blood cell production. But most of these leukemia cases are also hereditary, or we could get it from our parents. Ways to avoid these circulatory problems, of course, get enough sleep, eat healthy food, especially those rich in iron. So you should get equal amounts of meat, including liver, protein, and of course, green leafy vegetables. And again, get enough sleep. So that's around 7 to 8 hours of sleep per day and less stress. So we could also prevent these diseases by taking in vitamins containing iron.
Ms. Bravo, that will be all the questions. Thank you.
Nice
again.
meeting you, and hopefully we have learned as a group a lot from this interview.
I did.